Hi, Dr. Kelsey here, and if you are watching this, thank you for being part of Motherhood Unlocked. This conversation with Dr. Amber Hull, a pediatrician, is designed to give you all some insights on potentially like normal questions that moms would ask at newborn to 6 months postpartum, and then also even just, my kids are older, so even just a little bit selfishly of like, what would you give tips to in that time, because it just seems so far away. So go ahead and introduce yourself. Tell them a little bit more about who you are.
Hi, I'm Dr. Amber Hull, and I am the owner and private practice pediatrician of Village Pediatrics here in Las Vegas. So I do direct primary care. I don't take insurance. I only go into people's houses. I have a membership-based practice, so I get to have these really amazing relationships with my patients and their families.
So my main question initially, when it comes to, you have maybe like a 3-month-old on your caseload and it's a well child visit. When you go into that well child visit, what kind of things are you thinking about that you want to bring up to mom?
So typically in the first year of life, our routine well child visits happen at birth, 2 weeks, 1 month, 2 months, 4 months, 6 months, 9 months, and 12 months. That's the routine maintenance schedule.
Which is a lot.
Yeah, it's a lot. And during that time, we're looking at developmental milestones. Like, one of the biggest things is is the baby feeding well? Are they peeing and pooping? Are they gaining weight? Are they doing things like smiling? A social smile is a 2-month milestone. It's a very gratifying 2-month milestone because those first 2 months of life are very challenging. And so when the baby smiles at you intentionally, it's like, oh.
This is what I get after all of the nights and all of the feeding and all of that stuff.
And all of the exhaustion. So laughing is a 4-month milestone. They're usually starting to develop some core strength. They're not sitting independently at 6 months. But usually between 6 and 9 months, they've got enough core strength. At 9 months, they're often crawling. But the most common question that I get is this normal, right? And so when I say developmental milestones, the range at which kids meet those milestones can vary significantly and still fall within the range of normal. And so one of the things that I really has become one of the main parts of my job is, sort of helping people filter through, all of this noise on the internet that really puts a lot of stress on parents. And they're like, is my baby, are they developing properly? Are they going to get into Harvard? Putting all these expectations on this tiny person very early in life. And so I just remind people, don't compare yourself to an Instagram filtered version of someone's curated reality.
Totally.
Parenting is messy.
Oh yeah. It's messy, it's inconsistent, it is not, there's a lot of fluids going on, it's just for everybody. So that definitely, does, as a mom myself, that is when we searched, I didn't know you at the time when I had my littles, but when we had pediatricians, I actually had an OB who was a family practice physician for my first. So she saw me during pregnancy, saw me postpartum, saw my son, and that's the type of person that I had found. And so you need that confidence builder, but also understanding if you get to a certain point within that range, there's opportunities here.
Right.
And so it's kind of like you are shepherding them through in that regard. I think sometimes, at least from what I hear from moms or even mom friends, and why I asked you as a pediatrician to kind of break the fourth wall of that's not necessarily how it always is a lot of dismissal from a pediatrician or any provider of where it's kind of you can just ignore that when someone's saying they want some support. So when you have someone who's searching for support and you're kind of deciding how do I give that information to them, what kind of services do you use? Do you use early intervention? Do you use private practice? Do you use kind of a combo? What do you?
It kind of depends on if we're talking specifically about developmental delay. Right. And this is something that I'm very in tune with because I train in neonatal intensive care. And so I've seen kids with very significant either chromosomal or extreme prematurity or, some sort of traumatic delivery where there was hypoxic ischemic encephalopathy that involved brain development. So I've seen a broad spectrum of like, we need to sort of run interference before this kid, like they get early intervention pretty much from the time they get out of the NICU,
right?
Versus like, oh, you know, there's like a little soft kind of like subtle things that are, you know, the kids throwing me like yellow flags. We're not quite red flag yet, but let's get an extra set of eyes. Early intervention is a state-funded program. Many times they'll come out to the house to do an evaluation and, you know, just say like, this is within the realm of normal versus this child needs services. But kids have to be at like a 60 to 70% deficit in order to qualify for services through Nevada Early Intervention.
They do. And from my background in early intervention, not in Nevada, but in Washington State, that's definitely something that was very different coming here. And I mean, Motherhood Unlocked is a group that's local to Vegas, so the state of Nevada is our area that we're talking about. And previously in Seattle, you could have a weekly visit with an early intervention specialist. And here, from what I have heard from most families, is that it is like fighting tooth and nail, even with a diagnosis of something very specific, to get that intensity of services. Right. And so it's a great resource to have, but you do kind of have to patchwork things together for families and know, and that's, you know, you're amazing in doing that for families. Not every pediatrician is going to do that. So that's kind of what you want to look for in pediatricians, is someone who's either has the staff to help you do that, like a medical assistant, or who will do that themselves.
Yeah, and a lot of times when I've sent kids to Nevada Early Intervention, even if they qualify for services, they're seeing someone like maybe twice a month. Yeah. And so for some of these little guys that like really could benefit from, you know, more assertive speech therapy or more sort of occupational or physical therapy, you know, I'll offer to refer the family to private. And you know, and a lot of times when I'm seeing these little guys, I'll be like, let's start with Nevada Early Intervention, see what they have to say. And if that doesn't get us where we want to go, then we need to start looking for private speech therapy or private occupational
or groups
therapy
or something like that, and that is something that I think is really just helpful for the family, in addition to it's someone really explaining what they're seeing, a professional explaining what they're seeing, having that sounding board, and that can be very helpful even if they don't go down the path of this full service plan with these people. So always something I recommend. And then another question that I have for you in regards to like us being in the desert is the reality of how do you manage hydration for a newborn to a 6-month-old, beyond obviously 2, but like really in that early time for a baby and an infant?
So I don't recommend water. What was taught to me in residency is don't give a child water until they're old enough to ask for it. Because if a child is drinking fluids, they really need calories for weight gain. So if they're under 6 months old, like breast milk or formula, period. And really, like, I don't even really recommend water until they're closer to like 9 to 12 months, like maybe, and then just like 2 or 3 ounces, maybe. But kids really need the calories to grow, and they're getting hydration through that breast milk and formula. With water, the question that I get not infrequently, because kids puke, you were talking about fluids, like when they get pukey, and especially if they get these really aggressive stomach bugs, which happens,
if you're
and
around kids, daycare, whatever.
And they're vomiting, having diarrhea, they're losing fluids left and right, they're not really interested in like eating, they may not be interested in milk. I still, like in infants, I never recommend water for fluid replacement when they're sick, because they're losing electrolytes through the vomiting and diarrhea. And if you replace that with a hypotonic solution, or like a solution without electrolytes, which is what water is, you can actually deplete their electrolytes to the point where they'll seize. So I recommend that parents keep Pedialyte on hand, Pedialyte popsicles for your toddler age kids. And that's the kind of thing that just like get it in infancy and like put it in the fridge or in the cabinet, because kids always start vomiting at 2 o'clock in the morning. And that's not when you want to go to the farm.
They're not like, hey mom, in 6 hours after you're done with work, I'm gonna vomit. That doesn't happen, unfortunately. And even if it does, you're like, well, I got stuff I gotta do, and then I'll get there when I can. So definitely good. So the Pedialyte, some kind of electrolyte solution. even if, okay, so I gotta ask this question with the fact that there's a lot of like, dyes, no dyes, blah, 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 all that like kind of restriction stuff, which is good. What about if you did like a homemade Pedialyte or a homemade Gatorade or like any kind of that type of situation?
It's very easy to get kids' electrolyte imbalances suboptimal, right? And I never advise, like, first of all, kids shouldn't have honey if they're under less than 12 months of age because of the risk of botulinum toxin. And I have seen kids in the ICU as a result of honey under 12 months of age. But it's very difficult to just oh, let me mix a little salt, a little sugar, a little of this, a little of that. Like, you're not going to get the levels of the potassium right,
like there's titrating that, like really getting down to that detail is tough. Yeah,
and it's difficult to get it right and very, very easy to get it wrong. And the fallout from that could be a child with hyponatremia to the point where they are, you're taking them to the emergency department seizing. And I know that there are a lot of these products out there that are just filled with garbage, but it really should it should be properly formulated in order to be like oral rehydration therapy.
And I think the tide has, it has swung a little bit to be able to have maybe more awareness in those things like a brand Pedialyte, etc. So I think there's a little more awareness. And I mean, if you're in a red light situation where you need that, it would probably be better to just do that for the short term to get yourself out of it and then make other choices that you would typically make. But of course, like, none of this is medical advice, but I know that comes up a lot. And with living here, we keep ourselves, or should be trying to keep ourselves, hydrated as adults, and that can be an easy crossover. When it comes to developmental milestones, I think that was, a really great kind of expansive explanation on how it's different for each family, understanding who's right in front of you, and that there's a lot of ability to connect to resources. We just have to be able to have that conversation. If there's one, go ahead.
And there's one kid may be different from the other kid too, right?
Absolutely.
Every child develops at a different pace. And this is why I say stay away from people on the internet shitting all over you. You should be doing this and you should be doing this and pay me this much money so that I'll tell you what I did to make sure that my kids are going to be healthy and going to Harvard when they're 15. And every kid is different and every family is different, and the parenting strategies that you use on your daughter may not be the same ones that you use on your son, and what is really effective for one child may be totally different for another. And
as a mom of two boys who look almost identical all the time, they're like, oh, you must be brothers. They are not the same person. They are not the same person. And also, I had one in Seattle and I had one here. So just our family structure, closer to family versus here, is also very different. So I agree with you in that early stage. If you have multiples, it's really paying attention to who's in front of you. It takes a lot out of you as a parent, but it's ultimately very helpful, and that's why you have groups or support to be able to use those strategies. If there's one thing that you would tell a mom in those early months, maybe two things if you need to, but what's 1 to 2 things that you would tell them?
The days are long and the months fly by. And we have little children in our lives for this much time. And during that time, and I feel so blessed that so many people have asked me to be a part of this transition for them from pregnancy into parenting and early childhood. And it's sometimes people are just blindsided by the amount of work and the sheer level of exhaustion and frustration and self-doubt and all of these emotions that come in those early chapters of parenting. And give yourself some grace, recognize that you're going to get some things wrong, and some people are going to tell you that you're wrong and you're not wrong, and there's a lot of different ways to be a good parent. But showing up
Yeah.
being sober, knowing when, you know, you need to put the baby in the crib where they're safe and just
Right.
walk outside and cry. That's okay.
Yeah.
And, you know, at the end of the day, this is a season of life. It is a chapter. And, you know, you signed up to be a parent forever, and you're still going to be those boys' mom when they go to their first day of kindergarten, and when they go to their first day of high school, and when they get married, and when they're calling you up being like, Mom, you know, they broke my heart.
Yeah.
Like, all of that, like, emotion and trying to figure the world out, both for yourself and for someone else, is like, it doesn't end. But those really exhausting days of like early infancy, they're over just like that.
They are. And having a few moms that you know, or having a pediatrician that you really can be honest with and not feel like you're, you know, trying to teach to the test of whatever list they have is really important. So thank you so much for your time and your insight. I think you are hanging out on Substack.
I am.
So tell them where to find you if they want to hear more information about what you do.
So I do have a Village Pediatrics Instagram account. I don't really use Instagram so much for the reasons that I've just said. But I am on Instagram at Village Pediatrics Vegas, and I'm doing a lot of writing on Substack at dramberhall.substack.com. I write about a lot of different topics around the culture and relationships and intimacy and parenting and, you know,
stuff.
medical education videos and talking about stuff that you don't often have time to address in doctor's offices. So dramberhall.substack.com is the most direct way to get me.
Perfect. Thanks again, and have a great weekend. Thank you for watching.